presented in all this presentation about dogs. So this is a protocol that is under investigation at the moment in the Paris Vet College, so don't imagine that it's something that works 100% of the cases. It's under investigation. We are doing what was proposed by Daniele Zambelli in Bologna. It's what is done in humans sometimes. It's sclerotherapy with ethanol. So in fact, the dog is put under general anesthesia, and all the cavities bigger than 1.5 centimeters are aspirated, either cysts or abscesses. And then, without removing the needle, otherwise you don't see where is the cavity, you leave the needle in place, you are going to inject ethanol 95%, about 1/3 of the aspirated volume of the cavity, and then you are going to leave it for about 20 minutes. And it's useful to use anti-pain compounds. And then after 20 minutes, you re-aspirate it. You can rinse the cavity with sterile saline solution, and eventually, if there is an abscess, inject in situ some androfloxacin or norvofloxacin or any chloroquine. So it's quite complicated, but it seems to work quite well. And from the different reports and from what we saw at the veterinary college, is that most of the big cysts are treated after 2 or 3 weekly aspirations like this. And abscesses, sometimes it's a little bit longer. And very big cavities, like that abscesses are transformed into cysts after 1 or 2 aspirations, so there is no danger of septic shock, you just have to continue making weekly drainage. If you have very big cavities, and if after 2 or 3 drainages they don't diminish, then you have to go to surgery. There is one recent publication also that showed that about 1/3 of these big cavities inside the prostate, they contain urine. And these cavities, when they contain urine, they don't respond very well to a medical treatment. So in this publication, they recommend to assess the creatinine level inside the cavity and also to assess it in the blood. And if the ratio between the intraprostatic creatinine value and the blood creatinine value is more than 2 or 1, then maybe you can think that the ultrasound drainage for the cavities will not work very well. So that's, of course, there is only one publication stating this, so I cannot tell you that it's 100% sure, but it works quite well. So as a whole, you see that most dogs improve clinically with this drainage. The majority of abscesses are transformed into cysts after 2 drainages, and the big cavities, they need usually 4 drainages to disappear. What happened in this dog? So we put the dog under androfloxacin for 1.5 months and iposan for 7 days to diminish the prostatic volume. What happened? 1 week later, we still had cavities in the prostate. So we did another drainage, and we injected ethanol in situ. 2 weeks later, it was a little bit better, but there was still some liquid inside. So we did another drainage, and after it was okay. 1 month later, that was the aspect of the prostate, with only very small cavities and a diminution of the size of the prostate, very clear. So we followed the spermiogram. After 2 months, it was better, and so the dog had 2 further litters, and then there was a recurrence of prostatic problem, not abscesses, but we had benign prostatic hyperplasia that reappeared, and we castrated the dog. But it allowed the dog to be treated from these abscesses and to have further litters. Do you have any questions on this case? Yes, there was a question here.
Thanks. I just have a quick question. So Ludwig was doing fine clinically, but would you also recommend drainage for a patient who's already showing signs of septicemia?
No. Of course, if there are signs of septicemia, you should first treat the metabolic aspect of septicemia and give, of course, intravenous antibiotics and everything that is needed. In the cases that I have seen, prostatic abscesses, I must say that we see what? Between 1 and 3 cases per year. It's not a lot. In all the cases that I have seen personally, the dogs were completely normal clinically. It was just a discovery by ultrasound. It's amazing because sometimes I remember one case of another German Shepherd that his prostate was like a big abscess, nearly no parenchyma, and the dog was completely normal. And he was ejaculating pure pus. The ejaculate was pure sperma, only no spermatozoa and only polymorphonuclear cells. And the dog was perfectly okay. But first, if you have septicemia, it's the first thing you have to take into consideration before anything else.